So guys, this was all about the letter. Which letter we were discussing about? The non-emergency or the simple letter. Let me discuss about the emergency letter or the urgent letter in a single slide. Assalamu alaikum guys, my name is Dr. Faraz Ahmad, and today again I am here with a very important and very productive video for you people, and this video is typically on writing. In this video we will discuss about writing tips and types of letters and parts of the letter. So let's start with the video now. So first of all, let me discuss about some writing tips. So guys, during writing always keep in mind the following points so that you can score well in your writing letter. Always keep in mind that your writing time consists of only 45 minutes. So in these 45 minutes you have to use 5 minutes for reading of the task, and rest of the 40 minutes you have to write down the answer of the task. So always keep in mind. One thing more important is this, that you should always use 2B pencils, lead pencils. So the benefit of using the 2B lead pencil is that if you commit any mistakes, then you can easily erase it. Okay, always use 2B pencils. Write the letter between 180 to 200 words. It can be 10 to 15 words short, or it can be 10 to 15 words above 200. Okay, use the template to write the letter. Always use the templates to write the letter. This is very important point we are discussing. I will discuss these templates shortly. So always use these templates. If you use the templates while writing the letter, you will not be lost. Okay, always use the template. Then always practice in the official answer sheet. Yes, try to practice your letter on official answer sheet, so that on exam day you don't feel any embarrassment or any other problems. Okay, official answer sheet should be used. Try to finish your letter in 35 minutes, and then in remaining 5 minutes out of 40 minutes you can easily review your letters, and if there is any mistake you can erase it. Okay, let's move forward. Okay, read the corrected letters. Once you write down your letter, once you write down the answer of your task, then you should read the corrected letters from Futureland, from Benchmark, from Shows, or anything, any other website. Just always read corrected letters so that you should learn about your mistakes. Use the long templates for short cases and short templates for long cases. This is very important thing. If your case note is just short, then you should use long templates. If your case note is long, then you should use short templates. This is very important point. We will discuss it shortly. Okay, and guys, this is very important point again. Leave a line between the paragraphs. Always leave a line. Always leave a line so that your letters looks in a decent way. Okay, any paragraph should contain more than 2 sentences. In every paragraph there should be 2 or more sentences. If you write the whole paragraph in 1 sentence, it looks some ambiguous. Okay, avoid very long sentences. In long sentences there are chances of mistakes. Okay, use of punctuation is very important while writing a letter. Okay, use the singular and the plural form. This is very important. Make sure that you use the articles correctly. Use of articles is very important for writing a referral letter. So guys, this is very important point. In every new paragraph, use patient name in the start, then use pronoun. When you start a new paragraph, don't mention on 30th March 2020 she presented with. No, Mrs. Jones presented with. In the start, always use patient name, then use pronoun. Okay, Mr. James presented with this. She was ordered and she was prescribed. In start, use patient name, then use pronouns. This is very important. Keep in mind. Okay guys, this is very important slide. Now we will discuss about the types of the letters. Guys, in OET written exam, there is always a letter for writing task. This letter could be a referral letter or this could be a discharge letter. In today's video, we will completely discuss about the referral letter, and we will shortly make a video on discharge letter as well. So the referral letters, there are two types of referral letters. One is emergency or urgent referral letter. The other one is simple or non-emergency referral letter. Okay, let's move forward. We will discuss the templates of the letters in the parts of letter. How to write this emergency letter or simple or non-emergency letter. We will discuss their templates in parts of letters. So let's start. What are the parts of letter? Either it's a referral letter, either it's a discharge letter. There are some parts. So letter has following parts: initially address, then introductory paragraph, then body 2, then body 3. At the end there is a conclusive paragraph, and at the end salutation. Okay, now we will discuss every paragraph one by one. First of all, let us discuss about address. So guys, how you will put address on start of the letter? On upper left hand of the page, just mention date. You can mention, there are many formats of date, but this is a very important, and this is mostly used template, so always try to use this template. Just mention date, then month, and then the year. Okay, this 21st 3/20. Okay, then leave a space. Always keep in mind, leave a space. Then mention Dr. Faraz Ahmad. Every initial word should be capital, like doctor is capital, F is capital, Ahmad A is capital. Then future endocrinologist, future F is capital, endocrinologist E is capital. Like this, every first word should be capital. Okay, Dr. Faraz Ahmad, future endocrinologist, DHQ Miyawali. All right, then leave a space. Here you will mention dear Dr. Ahmad. Use family name, no Faraz, dear Dr. Ahmad, and placement of comma is very important after dear Dr. Ahmad. This is very important. So there is another important point, guys. If you are given with admitting officer, you have not given with the name of the doctor in the your task case note, then you will mention admitting officer. If you mention admitting officer, future endocrinologist, DHQ hospital Miyawali, then you will mention dear sir or madam. Okay, then you will mention dear sir or madam. Keep in mind. Okay, after Dr. Ahmad or comma, after sir or madam comma, you will then mention patient details. You will mention re and Mr. After Mr. you should have to place a full stop. Barley Jones. There are 3 templates here. You can mention patient details. First of all, Mr. Barley Jones, comma, date of birth in the same line. Second template, you can also mention date in the second line, Mrs. Barley Jones. Then you will come in the below line and you will mention date of birth. You can also mention Mr. Barley Jones, comma, aged 27 years. For this pattern, aged 27 years, you have to calculate the age of patient. Okay, guys. So this is all about the address of the letter. Let's move forward. So now we'll address of the letter will be the same in both emergency and non-emergency letters. Now we will follow the template of the simple or the non-emergency letters. In a writing task, mostly you will face a simple or non-emergency letter. So I am going to discuss this letter first. So guys, after address you will have to put a purpose or introductory paragraph of letter. This paragraph should be consisted of mainly 2 sentences, and it should no more than 25 to 30 words. Now I have given 3 to 4 templates here. Let me read for you people. We can start with I am writing to, or we can also start thank you for seeing. We can start with I am writing or thank you for. Both these templates are used. You can start with any one of these. So I am writing to refer Mr. Jones, comma, a 27-year-old accountant. Okay, then comma, who has recently developed. You can mention anything which patient has developed. Then your further assessment, your further management would be highly appreciated. This is the format. This should be like this as well, like thank you for seeing Mr. Jones. Sorry, I have missed a 27-year-old manager whose clinical features are consistent with, or you can also mention whose clinical features are suggestive of blah 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 dash dash dash. Your further management would be highly appreciated. These are 2 templates. You can also mention like this. This is a 3rd template. I am writing to refer Mr. Jones, a 27-year-old barber who is presenting with signs and symptoms suggestive of dash dash dash. I would be grateful if you could manage his condition as you think appropriate, or I would be grateful if you could manage his condition appropriately. You can mention as you want. Okay, so first of all, there is introductory paragraph. This paragraph is same for emergency letter or non-emergency letter. The difference start after the introductory paragraph. Here is the difference. So difference start in the body of letter. In non-emergency letter, in simple letter, after the introductory paragraph, you have to mention social, family, past medical or allergic histories. In body of letter, body 1. In body 1, after introductory paragraph, you will mention social, family, past medical and allergic histories. So you can mention like this: Mr. Jones is single. Regarding or in terms of his medical history, you will always put comma here, guys. You will always put comma here. Okay, regarding his medical history, he suffers from dash dash dash, for which he has been taking dash 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 medication. Please note he is allergic to penicillin or something else. Okay, mention this. There is one important thing as well. Always put present tense here. This paragraph should always be mentioned in present tense. Okay, the next template you can use: Mr. Jones is widowed man and has 2 children. Okay, here he was single and here is widowed man and has 2 children. He has a medical history of dash dash dash. Please note dash dash dash, he is allergic to dash. Okay, there could be another template. You can see here: Mr. Jones is single. His past medical history is unremarkable apart from the hypertension, apart from diabetes. You can mention here. Okay, which has been managed accordingly. Please note what? Please note he is allergic to penicillin. Okay, there is 4th template as well for this paragraph. You can also use this: Mr. Jones is married and has 3 children. His medical record reveals that he has a long history of hypertension or any other disease for which he has been taking dash medications. It is worth mentioning that he is allergic to dash dash, any medication, anything. He is allergic to anything, you will mention here. So it is a paragraph in which you mention social, family and past medical history after introductory paragraph in non-emergency letter. After this paragraph, then you will come to the visits of patients. Mention patient very initial visit, first visit. Okay, in this paragraph you will mention previous visits, very first visit. In very first paragraph, it will always be in the past sentence. You can start like this: on 1st March 2020, or you can start like initially, comma, on 1/3/20 Mr. Jones presented with, or you can also write like this: Mr. Jones attended my clinic with a 2-day. This is an important point. If you put a slash between 2 and day, then it will be a 2-day. If you don't put a slash, then it will be a 2 days. Okay, Mr. Jones attended my clinic with a 2-day or 2 days history of anything. What is the history of the patient? You will mention here. Okay, 2 days history of, and then you will mention consequently or as a result antibiotics were prescribed, he was given, he was commenced on. Okay, then you can write 2 weeks later. You will always put comma here. He developed something like a dash and dash, therefore he was given IV antibiotics or IV steroids. Later on, comma, he developed dash 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 too. So this is the template. In this way you will continue and continue. Okay, then this is the body 3. Here you will mention the visits in 2 paragraphs. In first paragraph you will mention initial visits and visits in between first and last visits. In other paragraph you will mention 2-day visit. 2 days visit should always be mentioned in separate paragraph, and it should be always in the past tense. Okay, we will start like on 2 days visit, comma, Mr. Jones accompanied by his mother, Mr. Jones presented with, Mr. Jones came with. Here I have mentioned that Mr. Jones accompanied by his mother, complaining of or complaint of. You can also mention in any paragraph examination findings, like you will mention on examination. There will always be a comma. Enlarged cervical lymph nodes were noticed. Hepato and splenomegaly were noticed. Enlarged liver and the spleen were noticed. You can mention anything here according to your case note. So he was given dash. Additionally, comma, relevant blood test along with the chest x-ray were ordered. So guys, learn how to use connectors in letters. Use of connector will always promote your beauty in your letter, and you will score good marks in your letter when you use connectors. So let's move forward. Okay, at the end you will mention conclusion. In conclusion, always keep in mind you have to mention always in view of the above. You should learn by heart this line. In view of the above, comma, I am referring Mr. Jones for further management of his condition. Okay, then you will leave a space here. Should there be any queries, please do not hesitate to contact me. Always keep in mind that these words, should there be any queries, please do not hesitate to contact me, they are not counted in word counting. Okay, let's move forward. At the end, in salutation, you will always mention yours sincerely. Keep in mind this Y should always be a capital, and sincerely, S of the sincerely should always be a small. Yours sincerely, comma, so you will leave a space here. Doctor, always put full stop here after doctor. Guys, an important point here, if you start the letter with dear sir or madam, if you were not given with doctor name, you mention above the admitting officer, then you mention dear sir and the madam. So at the end you will put yours faithfully, comma, and doctor at the end. So guys, this was all about the letter. Which letter we were discussing about? The non-emergency or the simple letter. So let me discuss about the emergency letter or the urgent letter in a single slide. Here I will discuss the differences in just one slide. So guys, the format for the emergency letter or non-emergency letter is same. It has the same format except the placement of today visit. Where is the difference? The placement of today visit. In non-emergency letter, today visit was just above the conclusion, but here in urgent or emergency letter, today visit, it should be given immediately after the introductory paragraph. In this emergency letter, we will place today visit when we will place immediately after introductory paragraph. This thing should be keep in mind. So how we will start? We will start with address, then we will mention introduction of the letter. After introductory paragraph in emergency letter, we will mention today visit. Always keep in mind Findings on examination will always be given in present tense. On today's visit, findings should always be given in present tense. Okay. After today visit, all the other visits will be given in chronological orders, and then after these visits you will mention social, family, past medical and allergic history before conclusive paragraph. Okay, after this social, family, past medical and allergic history, you will mention conclusive paragraph and then salutation. So guys, this is just a game, or just a difference of just placement of paragraph between emergency and non-emergency letter. I hope you people understood it. I hope I was clear in understanding you people the difference between emergency and non-emergency letter. Hope you will find it beneficial. Thank you. Keep in prayers. Good luck for your OET exam. Thank you. Bye bye. Allah Hafiz.